Hello everyone. Continuing with the topic of varicose vein. Um, Now we will ask for the personal history. In personal history, if it is a woman, then we ask for the obstetric history, like the details of the previous pregnancy, like whether she suffered from the white leg in the previous pregnancy. White leg is known as phlegmasia alba dolens in case of lymphatic obstruction. And is there any history of intake of oral contraceptive pills for a long time, because it is also a cause of the DVT. Um, the varicose veins are more common in women than men, mainly a ratio of 10 is to 1, 10 times more common in the woman. Now family history is also important. There any history of the varicose vein in the sister, in the mother. Now moving further to physical examination, inspection. On inspection, we see the varicose veins. Uh, we will first try to find out whether it is a long saphenous vein, short saphenous vein, or both. How we will identify whether it is a long saphenous vein, short saphenous vein? If it is a long saphenous vein, course is front of the medial malleolus, medial side of the leg, knee, thigh, and then to the saphenous opening. Short saphenous vein, it is start from behind the lateral malleolus, posterior leg, and popliteal fossa. Uh, now as we have come to know whether it is a long saphenous vein, short saphenous vein, or it can be both, now we will on physical examination, inspection, we see the swelling, whether the swelling is localized or generalized. Localized swelling, it can be involvement of the segment of the superficial vein, or it can be involvement of whole trunk, great saphenous vein, short saphenous vein. Or localized swelling can be seen in case of superficial thrombophlebitis. If it is generalized swelling, it is mainly a DVT. Now we see the skin of the limb. Now in skin we see the color. If it is red in color, it is mainly superficial thrombophlebitis, mainly seen in case of IV cannula. If it is color is white, known as phlegmasia alba dolens, white leg. Swollen limb, it is mainly due to the lymphatic obstruction. Blue is phlegmasia caeruleus dolens, seen in DVT. In DVT, D veins are thrombosed, therefore blood will not able to flow from superficial system to the deep system through the communicating veins. There will be a collection of the blood in superficial veins. As the venous blood is deoxygenated, leg will be blue and congested. In case of severe venous obstruction, as there is a no venous flow because of the obstruction, there will be a slowly the due to swelling, there will be compression of the arteries, arterial pulse cone, and then this will lead to venous gangrene. On the skin, we second see texture. If the texture is skin of the limb is stretched and shiny, it is mainly due to edema because of DVT. We see the eczema, pigmentation, ulceration, mainly the venous ulcer. They are seen on the goiter area, means the medial aspect of the lower part of the leg. Scar of any healed venous ulcer of the previous operation. We inspect the toes. If there is a brittleness of the nail or the loss of the hair, this tell about the impending venous gangrene. There is one test, Morris's test. We ask the patient to cuff. If there is any impulse on cuffing at the saphenous opening, means Morris's test is positive, is known as saphena varix. Now we come to the palpation. In palpation, varicose vein, there are total of 9 tests. Palpation, our aim is to locate the incompetent valve. First is Brody-Trendelenburg test. It is for both the longs or great saphenous vein and as well as short saphenous vein. In case of long saphenous vein, check the incompetency of the short saphenous vein and the other communicating system. In case of short saphenous vein, check the competency of the saphenopopliteal junction plus other communicating system. Now procedure. In both these, we first the patient position of the patient is recumbent. We raise the leg of the patient to empty the veins. The emptying vein can be hastened by milking the vein proximally. With the help of the thumb, we press the short press the saphenofemoral junction in case of short saphenous vein, saphenopopliteal junction in case of short saphenous vein. uh, or we can apply tourniquet just below the saphenofemoral junction or saphenopopliteal junction. Ask the patient to stand up quickly. There are two ways to do it. First, pressure is released. If the veins fill very quickly from above, means there is an incompetence of the saphenofemoral junction in case of great saphenous vein, and the saphenopopliteal junction in case of short saphenous vein, means it is a positive blue dye test, which is an indication for the operation. Second way is pressure is not released and it is being maintained for 1 minute. There's a gradual filling of the veins, means the blood is coming from the perforators, means there are incompetent communicating veins. In case of the great saphenous vein, it is mainly on the medial side of the lower half of the leg. The blood flow from deep to the superficial. This is also positive Brody Trendelenburg test, which is an indication for operation. Rest 8 tests we will continue in the further video.